My name is Dr. Ma Somsouk. I'm over at the University of California, San Francisco.
My name is Dr. Lukejohn. I'm also affiliated with UCSF.
Our study that has been accepted to GIE is entitled Adverse Events in Elderly Patients Undergoing Colonoscopy, a Systematic Review and a Meta-Analysis. Luke, can you tell us about why we performed this study?
Excellent question. So, as many people know, colorectal cancer is the third leading cause of death in the United States at this particular time. Given an advancing aging population, one of the issues that's raised is about the safety of colonoscopy. And so we decided to embark on looking at the literature that's available to sort of determine what are the risks associated with colonoscopy in elderly patients.
Yeah, and certainly when we think about older patients undergoing endoscopy, we also know that older patients have a shorter life expectancy. And we're concerned in this setting if there's increased risk of colonoscopy that they may not gain the benefit of an endoscopic examination. With regards to, so what did we do to answer this question?
So we first decided to sort of break the study into two parts, one doing a systematic review at the beginning and then doing a meta-analysis at the end looking at two comparison groups, the elderly and younger patients. And sort of in our systematic review, we sort of looked at all available literature at patients who had undergone colonoscopy and specifically looked at two age stratifications. Elderly patients, those greater than 65 years of age, and then also octogenarians, those patients greater than 80 years of age. And then lastly, we performed a meta-analysis looking at specific complications with respect to different age groups and seeing if there were any differences between the two.
And what types of complications did you look at, and what did we what did we find in terms of the various complications and its relationship with the elderly patients?
So what we want to do is look at sort of the common complications that we discuss with our patients when we are considering colonoscopy in them and also during the informed consent process. So we looked at cumulative GI adverse events, which included perforation, GI bleeding, and cardiovascular pulmonary. We also then looked at those individual ones as well, perforation, bleeding, and cardiovascular pulmonary. And then lastly, we looked at mortality. And what we found is, some very interesting findings. One, we found that the cumulative GI adverse event rate in both age groups, greater than 65 and greater than 80, is higher than what we previously thought. So for patients greater than 65, it was 26 per 1,000 colonoscopies, and that rose to almost 35 per 1,000 colonoscopies in octogenarians. And when you sort of drill down and look more specifically at some of the complications, we actually found that mortality was also higher than previously reported as well for both age groups. So we found a mortality rate of 1 death per 1,000 colonoscopies in patients greater than 65, and that was a little bit lower in octogenarians. It was 0.5 per 1,000 colonoscopies.
Given these findings, what do you think are the potential implications of the results, and how can we apply it into our everyday practice?
Yeah, no, it's interesting because when we also did the meta-analysis, we found that octogenarians had a much higher rate of cumulative GI adverse events compared to younger patients, and also their risk of perforation was also much higher as well. So I think in this particular age group, those greater than 80, we have to be a little cautious think about when recommending colonoscopy in that, making sure that it's for the indicated reasons, but also to sort of incorporate these into our discussions with our patients, specifically about the need for the procedure, but also I think the informed consent process as well.
One of the other things that is also beneficial with this study is that in studies in which we've looked at simulation models about what is the net benefit of performing colonoscopy by age, it's been limited to one estimate in terms of the overall colonoscopy risk. And this data, at least in its tiered form, where there are increased risk associated with age, may also alter some of our current recommendations for using colonoscopy in the elderly in terms of its overall net benefits in economic models. What are the next steps, and what are the limitations of this study?
Excellent question. So, as we found in our study that certain incident rates for specific adverse events were higher in elderly patients, we couldn't distill from the literature or abstract from the data why this was. So some potential things that could have potentially explained it would be things like comorbid medical conditions or potentially other medications that the patients were taking, or potentially the type of colonoscopy they were undergoing, whether there was therapy performed or not. These are areas that I think need to be further explored in the future to sort of tease out whether the adverse or the higher adverse event rates that we noted were actually caused by some of these things.
Sure. There are many things that age does not completely account for. For example, age is also correlated with getting more diabetes, other cancer diagnoses, or myocardial infarctions. And so some of these things that may be associated with age may in fact are the mediators of all these risks that are associated with colonoscopy.
Absolutely.
What are the take-home messages from this study?
Yeah, so I think we learned a couple of things. One, we discovered that the incident rates for certain adverse events was much higher in elderly patients, both in patients greater than 65 and over 80 years of age. And when you sort of look at all of these adverse events, cardiovascular pulmonary complications seem to be the highest ones that were reported. And when doing our meta-analysis, when we looked at octogenarian patients, we found that they actually had higher rates of cumulative GI adverse events than younger patients. And specifically, rates of perforation were much higher in these patients. So I think overall, I think this study adds to sort of the growing literature about the elderly and adverse events, and that we should sort of be cautious in talking to our patients about whether or not they should be undergoing colonoscopy, but also be discussing these and sort of maybe refining our informed consent process for elderly patients.